Miss Aspen here, one of our wonderful employees, often deals with some neck tightness. For Miss Aspen here, what I'm feeling right now is her levator scaps are always elevated, always has some good spots in there. One of the best ways to adjust the neck that I've found for Aspen is to do a modified cervical chair. When you're setting up the cervical chair, what I like to do is have them scoot forward just a little bit. I want to make sure that your feet are flat. We're going to have the palms up in your lap actually, and we want to have her head right around my belly button height, maybe slightly higher. I'm going to pull her hair out just so we can get a better feel for neck here. When I'm feeling on the sides, what I'm looking for, number one, is her cervical paraspinals, and then underneath the base of the skull, you have something called your rectus capitis posterior minor and major. On the side, we have her SEM. So this right SEM is a little tighter, and the transverse process of C3 is a little tight, or a little tender rather. As we move down, is that tender there at all? Okay. So for this, it's important that they tuck their chin. So go ahead and tuck your chin. The setup for it, I'm going to use my index finger, and I'm going to instruct her to allow her head to fall and relax to the right, as if she's going from right ear to right shoulder. So go ahead and let your ear fall from right ear to right shoulder. Perfect. How'd that feel?
Great.
Awesome. So on the left side, when I was palpating in there, I felt her C2 on the left. Is that tender there?
Yes.
All right. So same thing's going to apply here. I'm going to have her tuck her chin down. We're going to come up. She's going to look just gently up at the ceiling. Perfect. That feel okay there?
Yes.
Perfect. Awesome. All right, and now we're going to transition over to the table. So taking a look at Miss Aspen's leg length here, her pelvis seems pretty in line, except this right hip is a little bit elevated. So typically, that means that her glute med is going to be tight. Is that tender there? Okay. And then what about up top? Any tenderness there?
Yes.
Okay. So we're going to rotate her pelvis down and out here. And then we also need to do some counter nutation. So with counter nutation, we're bringing the sacrum down and back. So I'm going to have you take a big deep breath here, hold it, and exhale. Good. We're going to do that 2 more times. Big deep breath, hold it, and exhale. And last one. Big deep breath, hold it, and exhale. The purpose of the breathing, I guess, all the time is we're using her diaphragm to help traction out the disc space between her lumbars. On the right side here, we can feel her QL is pretty tight. Is that tender there at all?
Yes.
So we're going to do a bit of a counter strain mechanism here. So I'm going to have her take a big deep breath. I want you to squeeze your legs together as tight as you can for me. Squeeze, 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 squeeze. As you exhale, relax the legs. Perfect. We're going to do that one more time. Big deep breath. Squeeze the legs together as tight as you can. And then as you exhale, relax the legs. Good. Oftentimes, the QL can elevate the pelvis and make the legs appear to be uneven. So we're going to do a couple drops here. We're going to do some rotation at her L3. And also at her L1, we're going to do extension. And I've adjusted Aspen enough times to know that her L5 is usually a little tender here. Is that tender? Okay. So we're going to do 2 gliding motions going up with an I to S tissue pull, and then 2 in extension. Good, and as we look at the legs here, her wonderful vans are nice and lined up now. For Miss Aspen, sometimes I do a extension thoracic to help open up her chest a little bit. So I'm going to have you take a big deep breath all the way out. Good. Perfect. One more. All the way out. Excellent. All right, Miss Aspen, you are ready to rock and roll.